Welcome back to another episode of RNT Fitness Radio. Thank you, as always, for tuning in. And I know for a fact that this week's episode will not disappoint. So Akash and I have on the line Dr. Belisa, who we met out in LA a few weeks back, and we did a breathing workshop with her. Now, when you first tune into this, if you're anything like me, and I admit this during the podcast, you're going to think breathing, okay, next podcast, skip to the next one. I urge you not to do so. Dr. Belisa is one of the most energetic and excitable people that I've met. So, as I said, I'll allude to this in the podcast, but when we got told that we were doing a workshop on breathing, I sort of rolled my eyes and thought, you know what, I'm hungry. I'm going to go get a burger. However, within 5 minutes of Dr. Belisa starting to talk and present, I was hooked. Her passion just comes through right away, and she has a ton of experience. She's super knowledgeable. She has a background in clinical psychology. She's written books. She's been a contributor to various health and fitness magazines. She's got a great sense of humor. She can give the complexities, but she can also break it down and make it simple and deliver it in a humorous and energetic way, which you will get straight away from the tone of the podcast. And for the guys out there, she even gives a sex tip towards the end to improve your sex life. So there you go. There's a bonus for listening. Please stay tuned. Listen to what Dr. Belisa has to say. Her information is on point. It's entertaining. It's insightful. It's knowledgeable, and genuinely has helped me over the past few weeks since LA. My breathing patterns have genuinely changed. And for those of you that have been listening to our podcast for a period of time, my digestion is actually starting to improve. And again, I'm not going to give too much away. One last thing that I do want to finish on is listening back to the podcast. It's not clear, but I mentioned about yoga classes and how sometimes the elder women that do them sometimes fart. And apparently that's down to a lack of control over their pelvic floor muscles. I just want to clear up, because it wasn't that clear. I don't have an issue with not being able to control my flatulence. My pelvic floor muscles work absolutely fine. So for anybody listening, I have no issues in that department. I perhaps just did not make it clear. Anyway, enjoy. So how's your day been?
Great. I'm in San Francisco.
Oh, nice.
So I went from Los Angeles to San Francisco, and I'm here trying to finish writing. I'm sort of tethering myself to my desk and trying to finish writing because it's tough. I can get distracted by anything. So yeah.
What's the latest project? What are you writing about?
So this one is one that will not be out. I can't talk about it just yet, partially because it's not done. But it's the Breathing for Warriors book, which is, and I guess I can talk about it as far as what I'm teaching this year. But it's breathing for endurance, strength, precision, and recovery. So, a lot of you guys did sort of the basic class, and then usually what happens is that people then start asking or want more precise information about how do I breathe and brace? How do I breathe for endurance as compared to strength? How do I breathe for precision sports, which are a completely different thing. We can talk a little bit about that for sure. Yeah. And then about actually how to use the breathing like you guys did for recovery, because we're talking a lot about recovery, but not a lot of people actually doing recovery the way they need to be doing, given how hard their workouts are. So I know you understand that.
It's interesting you said that, because I've been training for a Tough Mudder recently. So I'll be doing some short runs, and I never run, right? But I was thinking the other day, how do I breathe when I'm running? Do I just take short breaths, or do I inhale slowly?
Well, breathing with running is that you have to work out your breathing muscles. So that's endurance. So actually, the working out your diaphragm and working out your intercostals so they don't get tired is what you need to do. And you can't work them out at the same time as your sport. So that's the sort of the pervasive myth, is that people think, oh, I'm working out my breathing muscles because I'm running. And the fact is that you have to stop running, sit down and do your breathing muscle exercises till you sweat, until you're really tired, but you're not moving because you're just focusing on your breathing muscles. Oh, wow. So, so big inhales, big exhales horizontally, and they will feel hard, and you will start to break a sweat really fast, but you'll notice that when you're running, you actually don't get as tired as quickly.
Oh, wow. So this is similar to the exercises you put us through in LA?
Yes, except for you guys got the basics. So now is actually when the kind of like fun, precise things start, where you start saying, well, how do I Valsalva better now that I know how to breathe right? How do I breathe between reps? How do I breathe for endurance sports, whether it be MMA or running or Tough Mudders? Or how do I breathe if it's a sport where I have to shoot or putt or anything that takes a lot of precision and you have to use your breath in a different way? So yeah, so after you get the basics down and your BIC, your breathing IQ is good, now you can say, now let me work out my breathing muscles. Because before, if I would have said you need to work out your breathing muscles, you would have gone up and down using your auxiliary muscles, and you just would have overtrained your auxiliary muscles and you'd still undertrain the real ones. So now that you guys know how to breathe horizontally and what your diaphragm looks like and what it needs to be doing, now you can train it extra hard. So I will definitely give you a workout so that your Tough Mudder will be a little bit easier, because I understand I don't like running, and I swore I would never run again. So even if the bus is, a block away, I walk and wait for the next bus because I can't stand that.
I can resonate with that.
Yeah. I'll get on the assault bike. Like I like that kind of movement, but just the running always seems like, especially being from New York, is that we're running all the time. So if I don't have to run, I don't want to.
I had no idea that you'd work with so many precision sports. So do you get a lot of
the precision sports? A lot.
Okay.
Yeah, a lot. And I just I was on the range the other day because I was looking at, I'd worked with golfers before, but I hadn't worked as much on the range with shooters. I had worked with military and law enforcement for stress relief and for endurance, but not as much for precision. And I'd always heard, golf and shooting are very similar. And so I went on the range and I shot, and I thought, oh my gosh, shooting and golf have nothing to do with each other. Whoever is putting these two sports together, they have nothing to do with each other. So shooting is much more like archery, and golf is much more like pool as far as the movements that you have to make and how you use your breath. But it's almost the other extreme of what you do for endurance, is that if you have a precision sport, you have to be able to control the slow muscles that have to do with the exhale. So it's a completely different exercise and mindset as far as what you're doing.
The first thing I want to introduce to the podcast, and I hope this comes across the right way. I have a habit of offending people.
Oh, don't worry. I'm super thick-skinned. You know me.
I hope you take it as a compliment, in that I love the way you deliver your message, and where it may possibly offend, I hope it doesn't, is that obviously we're on the Rennick. So for people that don't know, Akash and I were out in LA a couple of weeks ago. We're part of Jay Fruge's Renegade Weekend, which is all, workouts, and we did boxing and this and that, the other. And then we get told we're going to do a 2-hour breathing workshop. And I looked at Akash and I'm like, I'm fucking hungry. I'm going to be real, because I'd heard that we should breathe through our diaphragm before. We were at a gym previously where, we did a couple of team meetings on diaphragmatic breathing, and it was dry. But the first 5 minutes of you talking, I turned to Akash and went, I'm actually really looking forward to this.
Yeah. It went really quickly, right?
It went so quick. I found it so interesting. I mean, I was asking you questions, and I don't, usually I'm one of these people in a big group. I just, sit at the back, and honestly, so your delivery and like your passion massively comes across. So I hope this has been like a roundabout way of saying, I genuinely really enjoyed it. And that's why I spoke to Akash and said, we've got to get, I even spoke to you on the day afterwards and said, I'd like to get you on the podcast. So I think it's a super important topic, but it is quite, let's be honest, like unless it's delivered in this way, it can be pretty dry when you listen to it.
Oh, awful. And I'm going to take that as a compliment. I think that's an amazing compliment.
Good.
Because it really, most people come in and they're like, the diaphragm. Yeah, I know about that. I'm hungry. And I would be that person next to you going, can we slip out and go get a burrito? Do you think they'll notice? I completely understand that. But we went over. That time we went over 45 minutes. It was almost an hour.
Yeah.
So it's kind of wild when you're sitting in a workshop and you're like, wait, I don't want to go. Like, can they give us more?
Yeah,
so we went over 45 minutes. Yeah.
And also you got Adam's buy-in straight away, because when you did the assessment on him, the first thing you said to him was, have you got digestion issues?
Oh, yeah.
And immediately he looked at me thinking, how'd she guess that from the breathing? Right?
We'll come to that bit properly, but I thought it was just a generic question.
Yeah.
So
I remember that.
Yeah, when Akash said the two things you asked me were digestion and low back. And I get
and you said, is that everybody? And I said, no, that's just you.
yeah, I thought it was just a generic question that you just sort of like yes or no, you tick it on a bit of paper.
Yeah.
So when you said no, it's specific, I looked at Akash and I'm like, oh, wow, okay, there's something to this.
Well, one of the reasons I'm so passionate about it is because I've gone to so many classes and I love anatomy. I'm definitely an anatomy geek. And I'd gone to so many classes where they would talk about anatomy and they'd lose me. And it wasn't that I was that dumb. It was just that the technical words and a lot of them, and it wasn't tangible. And I would just sort of get lost in all the technical words and the vague descriptions. And I'd end up leaving and saying, wow, this person's really smart, but I don't really know what they were talking about, or I wish they would have broken it down a little bit easier, or that the language was just more practical. So the way I devised this class was for a class that would be good for me. So if someone was like me and wanted things to be very direct, very practical, sort of no fluff, and dynamic, let's go, not a lot of breaks.
Yeah,
and
it was
very, it was just very applicable. I made a class that would be good for me. And what I looked at was, I'm a child psychologist. So I look at how I spent a lot of years doing IQ tests with kids and adults as well, where, I'd take your average person and go through this whole battery of tests, the Stanford Binet, the WISC, and I even taught the Rorschach technique, the ink blots, for a while at NYU. And so I came from a background of, how do I test someone's brain? How do I look to see how they think? Can I give it a number? Is this number accurate? What's holding them back? So that's how I look at something is why isn't someone getting this, or why is this being described in a way that it's not resonating with folks? Never that they can't learn, more is that why are we not showing them this information in a way that resonates with them? So when I work with kids, you will see me, I go nuts trying to figure out how to get kids to learn something, because it's just that we're not presenting it right. So I will sing, I will dance, I will use crayons and markers and whatever it is to get them to get the concept. And once you figure out how they learn, it's really kind of easy. You just put everything in that context and they get it. So I was looking at breathing for whatever reason. I was thinking, this is interesting because people will post, on their Instagram, on their Facebook pages about breathing till the cows come home. You'll see posts every single day on, take a deep breath and, just breathing. People love posting about breathing. So we all love breathing. We can all agree on that. Mm-hmm. However, when you come down to how do you breathe, most people are doing it completely wrong. So I looked at it like a problem of everybody agrees this is really important, but then there's this huge gap in how are we doing it. And then when you go to look for explanations, you get super technical information that usually has to do with COPD or emphysema, or that has to do with the diaphragm and chakras and spirit. And both of those other things are good. And I'm sort of gesticulating to one side of the screen and the other side of the screen, but they don't help us, kind of your average person who wants to work out harder or better or recover better, that we're right in the middle. Maybe we don't have emphysema and, we address universe and spirit and all those things in our yoga class. And we just want to know, how do we get through our Tough Mudder, right?
Yeah.
So that's where I came in, is looking to see what words are we using that don't make sense and what words make sense, and how do I make this be something that people get really passionate about, because it's not easy. You can't see air, you can't see your lungs. So it was really a challenge.
Yeah. I mean, it resonated with me. Like, you kept it real, you kept it applicable, you kept it fun, humorous. I was engaged the whole time. And as you said, like we were asking you if we can overrun. And I noticed big benefits. We're gonna come to that in a bit, but I genuinely noticed huge benefits that it caught me off guard. Like I wasn't expecting that. When I got told we're gonna do a breathing workshop, I was a little bit like, I just want to go eat. But I was hooked. So thank you in advance. Let's. I guess we should probably introduce you. So for those that are listening, we've already started. We're well underway. We have Dr. Belisa. Let's talk about your background first. We're going to get into all the breathing stuff, but let's talk about your background as like a clinical psychologist, with relationship psychology and so on. And then firstly, how did you get interested in that and go down that route? And then what switched, and then how'd you go down and sort of the physiology route now? And then how do they meet? Let's all that good stuff.
All that good stuff. Okay, so I started at the very beginning. Most people ask about my name. So I'm half Serbian and half Cuban. But I was born in Madison, Wisconsin, so I'm what's called a cheesehead. I'm a nice Midwestern girl, but I'm half Serbian and I'm half Cuban. And I lived most of the time, I've lived the last couple decades in New York City. Right now I'm traveling. So I just live at the airport, which is not half as much fun as it sounds like. So I travel all over. So I'm not living really in one place at all. Like you said, my background is in clinical psychology. So I've had pretty much every job you can possibly have in clinical psychology because I am one of those people that just likes to learn more. It's not about really getting to have a shingle and an office. I did that and I liked it. And I have a lot of respect for people that can do that. But I was really on this mission to what else can I learn? So I pretty much I'm that person that's had every type of job ever because just the idea to learn something else was a lot of fun. Mm-hmm. And this is the first time with breathing and breathing exercises that there's so much to do that I think I'm going to stick here for a while and teach breathing. But I've worked with, in the parole system, I've worked with families. I was the health and sex editor of Men's Fitness magazine for a while. I've always done therapy, whether it be with couples or with kids. And I came to a year where I got really stressed out. So usually if you haven't hit that moment, I don't know if you guys have, where all of a sudden you think you control your stress and you hit that day where you get a wake up call that you are not controlling your stress, it's controlling you. And it's a blow to your ego because you think you have things under control, but all of a sudden something happens where you misread something because you were too tired. Or you thought you were really strong and you got injured and you're not going to be able to do what you thought you were going to do. It's that real come to Jesus moment where you realize that what you've been thinking and how you've been moving isn't going to work for you anymore, either given your age or your lifestyle or your goals. So I had that day come to me where I went to the dentist and found out that I was grinding my teeth. And I've told this story before, and I don't know if I told it actually in class. I probably didn't, right? So I go to the dentist and they tell me I'm grinding my teeth and I figure there's something wrong with my jaw. They need to, which is the first thing they do when you're grinding their teeth, they should look to see if your teeth are unaligned so that you're grinding on one side. So they say, no, your teeth are perfectly fine as far as how level they are. You're grinding because of stress. And my immediate reaction was being angry. And I thought, I have my stress under control, damn it, which is very telling because someone tells you are going to have to spend thousands of dollars getting your jaw repaired because of stress. Getting angry at them is probably not the best idea. But for me, I had my stress under control. And if anything, I was proud of how I could thrive under stress. So I'm living in New York City, getting out of a bad relationship with a boyfriend that wasn't right for me, working at Bellevue Hospital, which is the biggest psychiatric hospital in the world, I think. And it was around 9/11 as well. So that just lots of stuff going on. So I'm grinding my teeth and I have to figure out how to deal with my stress. And it has to be something other than going to yoga or drinking tequila. Like I have to actually dig kind of deep. Not at the same time. It's always a bad idea to drink tequila and do yoga. But I have to dig a little deeper and see what's going on with myself. So it was a very selfish reason that I got into breathing and breathing exercises, but it's worked out and I don't grind my teeth as much. So.
Also, breathing was how you solved your stress issues. stress issue?
Yeah, I actually was looking at breathing in yoga. So everything I teach, it's not all yoga breath. In fact, it's only a very, very small part of yoga. But when I teach breathing, I look at martial arts, I look at diving, I look at singing and yoga. And then there's about 10 other sports that I look at as well. But the initial interest did come from yoga because I actually liked the breathing exercises we were doing. And I found that I would calm down a lot more. Yoga class isn't always calming, especially depending on the class that you're going to. So if you're going to a very competitive power yoga type class, I know it defeats the whole yoga philosophy, but the breathing made me stay still. It made me focus on my breath. And then I went from there and started looking at, I would like explanations that are more practical than the ones I was getting in yoga. So now there are actually studies that are done with yoga breathing and brain scans. But at that time, I was given the yoga philosophy explanations for the breath that, although I loved, weren't as practical, weren't sort of the answers I wanted as to why, how, well, how many of these do I do and how should I feel and what numbers are there? So I came from a gym background. I wanted to know what my max was and how many I needed to know to get to the next place. And yoga didn't have those answers. So I started looking at breathing in sports.
Okay. So in a nutshell, and can you talk us the link between this? Breathing can help with psychological issues, you're saying. So anxiety,
absolutely.
Stress, if you can master your breathing, that can.
Absolutely.
And you've been through it.
Well, your breathing is the mechanism that controls your arousal. So that's the very long hashtag, is that your breathing controls your anxiety, your stress, and arousal. So we talk a lot about mind, body, the connection between the two, positive thinking, so on and so forth. But the actual mechanism, and I always, put my hand up and as if I'm turning a little knob, the mechanism that controls how you experience stress or how your body reacts to it is your breathing. And that sounds terrifically simple once I say it out loud, but in my world, no one had said it in that straightforward of a way. I thought I needed to do all these other things, which are good things, obviously positive thinking and slowing down and turning your gaze inward and doing whatever it is that keeps you in the present. But the fact is that your body understands stress or understands how your brain wants you to experience it by how you're breathing. So that was the chunk of information that for whatever reason, I hadn't been able to get or I couldn't find in a way that was really simple. So your brain, your circumstances around you are freaking out, or your personal life is freaking out in your head. And then you're trying to say, I want to calm down. So what do you do to get your body to calm down and your brain and your body to unite in that goal? You change your breathing to one that's calm. Now you still have the thoughts that are making you upset, but now now they're compartmentalized better. Now your brain can think about how to figure it out. Because your body is breathing in a way that's saying, okay, we have a problem, but I'm not going to have a stress response. I'm going to keep my heart rate down. I'm going to keep my blood pressure down. So you can just be more analytical about the situation.
So it keeps you in that parasympathetic state.
Exactly. And we talk a lot about parasympathetic, but then what exactly do you do? How do you understand parasympathetic? So what's nice about nowadays is we're talking a lot about vagus nerve and parasympathetic, but if you ask someone, how do you get into a parasympathetic state as quickly? How do you practice getting into a parasympathetic state? Not a lot of people can tell you. So you can practice it. Where I come from, again, child psych background, is that whatever you need to do, you can practice getting that way. So I'll give you an example of getting in a parasympathetic state. I can either use an example of a fighter who goes to his corner, or I had a mom who was having triplets. They're kind of similar in their high stress situation. But you have to be able to calm yourself down very, very quickly because you don't have that much time. And with the mom and with the MMA fighter is that I would have them do things so that their heart rate went down, and then they had to actually bring their heart rate went up. And then I had them do things so that their heart rate would come down, but they had to monitor it. So it wasn't just get excited, calm down. There was an actual number. And you get your heart rate to get really high and then use your breath to bring your heart rate down. And you practice that. So it doesn't feel like it's just magical. You actually have numbers. You watch your heart rate go up and then you watch yourself pull it down. And once you do that well, you go out into situations, if you're agoraphobic, for instance, or for instance, with this mom who was having triplets, she hated farmers markets. Too many people around her, it freaked her out. So once she had her breathing that was good and that she had control over, I made her go out into the farmers market and bring her heart rate down with her breath. So you can, all these things that sound a little bit elusive, you can actually make them be practical and practice them. The same thing with pain. If you're in a sport where you have to put up with pain, if you practice pain, you'll have more control over it, and it will be more discomfort, less acute pain that overcomes you.
Perfect.
Could you give us an example of what you do in a say we're feeling stressed about work, or what can you do immediately to calm your?
Well, immediately think about how I describe the vagus nerve, and I completely simplify it. So for you anatomy nerds out there, I break it down so that you can start to understand it, and then we can get more precise about it. But vagus nerve starts at your head, and it has tendrils that goes down throughout your whole body. And when you're breathing with the upper part of your body, your vagus nerve tells your brain that you need to be more alert, you need to be more vigilant, your heart rate needs to be up, you need to be in a more stressed out state because whatever's going on around you needs you to be in that way or wants you to be in that way. So if you're at work and you need to calm down, you actually need to send the message to your vagus nerve that you want to be calm. Regardless of what's going on in your head, you need to be calm. So that vagus nerve goes down, 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 all around your belly. So if you take a breath which widens your middle and then contracts your middle, you're actually telling your vagus nerve that you want to be calm. So I know that's super simple, but that's just exactly what's happening, is that if you breathe with your shoulders up and down, your vagus nerve hears he wants to or she wants to be more alert, higher arousal, higher heart rate, and you can actually go too high, which is what we're not looking to be, or you can bring yourself down into an alert, productive state, or you can go way down to I want to go to sleep state. So it really depends on how low you have the breath, how much once you have it low, how much you slow it down, and how convincing you are to yourself and how well you do it. So the best thing to do would be to take that breath that's at your shoulders and actually train yourself to inhale and widen and exhale and narrow.
So for the... No, go for it.
I was going to say, does that mean the inhalation is the relaxing part of the breath?
Thank you for saying that. That's actually perfect. I'm so glad you said that. Is that, yes, the inhale, you relax. And this is apart from your heart rate. This is just what you're thinking. Inhale is relax and expand. So it's relax your middle, relax your sides, relax your glutes. Okay. And exhale is actually a little bit more active than what you usually hear. Exhale is actually use your abs a little bit, maybe even tip your hips under and squeeze all that air out. Thank you for saying that, because the myth that exhale is let go really screws us.
That's the part where you hear people,
that's right.
And look at that breath. So look at that, like exhale, let it go is just intellectual. And we've taken that idea of exhale, let it go and made it something that's mechanical, which is completely wrong. So I'll backtrack if that doesn't make sense. But on the exhale, we're told let it go. So what do? We relax. And if you relax on the exhale, you're actually not getting all that residual air out. And you're making for the next breath being a breath that's just not going to be able to be a big breath because you haven't taken a good exhale. Does that make sense?
Yeah.
Perfect.
So essentially, the protocol you said is when you feel your heart rate's going up, you got to check yourself and then redirect the breath from your chest and shoulders down to your diaphragm or stomach area.
Exactly.
And the lower you go, the more relaxing it is.
Exactly. The lower and the slower you go. But some people can't even feel their heart rate. So when I work with folks that are super in tune with themselves, like snipers, for instance, can really know where their own heartbeat is. And a lot of people can't even tell. You'll ask them, what do you think your heart rate is? And they don't know. So part of the training that's very advanced is you get to start feeling your own heart rate. And that's kind of cool when I can get someone that they're so in tune with their body that they can tell me what their heart rate is. And it's really amazing because you can start feeling it in your body and knowing where it is. So more often it's not that you feel your heart rate go up, is I want you to be able to catch your heart rate even before that happens. So what is that tiny little feeling you get when you're like, uh-oh, just the back of your head that, you start hearing, uh-oh. So it's almost as if when you're working out or when you're in an endurance sport that you start feeling like you're going to run out of breath. Like, not that the breath is supporting you anymore, that all of a sudden you're like, I don't know if I want to win. I just want to get to the end now. So I want you to feel that the whisper that you have in the back of your head going, I think I'm getting stressed out. And I want you to hear it earlier and earlier. Whatever that is, whatever that cue is in your body, so that you can take the belly breath and keep yourself calmer. So, and that's what it is, people say breathing into your belly or breathing into your back. And I always stop and go, what does that mean? Because everyone in an audience, when you say, take a belly breath, will nod. Yes, belly breath is good for you. And you'll go, well, is anybody doing this? And why are you breathing into your belly? So no one knows. They know belly breath is good. And I don't advocate a belly breath. So we will do belly breaths in the beginner's class just to get you used to the concept that your middle expands on the inhale and narrows on the exhale. But at the end of the day, you want to be able to expand circumferentially. So inhale all the way around your body and exhale all the way around your body. And I just have to say, before anyone says, why would I want to expand my middle, is that if you let yourself expand your middle, your core is actually going to get stronger if you're breathing this way. So too many people who are worried about their middles being narrow, or even who are not that narrow and are just sucking it in because they're stressed out, letting go of their middle and expanding their middle is the last thing they want to do. And in fact, it makes them feel very, very uncomfortable. But if you realize that with every exhale, you're working out your obliques, all your ab muscles, even your pelvic floor and your back muscles, all of a sudden you start thinking, hey, I feel my core feels stronger. And it's because you have that movement of inhale, expand, exhale, narrow.
Just quickly, so you've just summed that up perfectly, but how it really got into my head. So I'm just thinking for the listeners here, because Akash and I have been through your class. Can you just quickly talk through the difference between up and down breathers and in and out breathers? Just so that people listening to this can resonate, who haven't been to your class and they're back at
Yeah, exactly. So what I want you to do right now, we'll actually kind of do an exercise. I expect both of you to be perfect because you've taken my classes. Come away from the back of your chair. So kind of perch on your sit bones, perch on your butt without you touching the back of the chair. Open your mouth and take a big inhale. And what you're going to notice is your gaze usually goes out into the distance and up a little bit, and your shoulders go up and you puff up your chest. So that's how we've been socialized to breathe. And that's how 99 out of 100 people breathe. Really, it's a very, very typical breathing pattern. Some folks will notice their shoulders go up on the inhale, so they get taller. And some people just top of the chest will get bigger, and maybe even their belly narrows. So if you think about that Superman pose, inhale, you puff up, and then exhale, you relax. So if you think about that relaxed breath, exhale, you kind of let yourself relax and come down. So that's called a vertical breath, because on the inhale, you tend to get a little bit taller, and on the exhale, you come and settle down. Unfortunately, this is completely anatomically incongruous. It's a socialized breath, but it makes no sense, none at all, given how our bodies are set up and given how we were designed. So the sort of breath that you want to take, that's one that's efficient, that gives you more control over your arousal, that uses the densest, biggest part of your lungs, that helps your posture and your diaphragm kick in, is one that's horizontal. So I want you to take your hands and put them halfway between your nipples and your belly button, and almost at your side, sort of in front of your body. And on the inhale, you actually want that part of your body to move. You want to keep your shoulders really still, and you may tip your hips forwards just to get your body to start doing that. So inhale, press your belly into your hands, tip forwards. You're going to have a movement at your hips. And on the exhale, I want you to rock back a little bit with your hips and even push your ribs into your body. So that's going to start you breathing in a horizontal way. So if you do yoga, you'll see that this feels a lot like seated cat-cow. And if you do, is it cat-camel, cow-camel at the gym? One of the Stuart McGill's exercises where that's a movement that's really good for your back is that on the inhale, you're going to widen, so big belly, and exhale, you're going to narrow your body, use your abs to get your belly button closer to your spine. Again, this is the intro breath. Once you get this breath down and it feels natural, because it should eventually, you'll be able to inhale, expand all the way around so you don't look like you have a big belly. And on the exhale, you narrow your body so you feel your obliques, your back muscles, your abs, everything contract and squeeze all the air out. So the way you should be breathing is that horizontal way. And if you need a reminder, all you have to do is not look at your baby, because they don't have a lot of choices about anything, is look at your toddler, your 3, your 4, even your 5-year-old, or look at your family pet. So whatever you have, any pet you have, you look at them breathe, they are never going to be breathing with their shoulders. They're always going to be breathing with their middle.
Yeah. So when our hands were in between our nipple and hips, pushing out, that's almost like just the oblique muscle. That's what we're feeling expand, right? Around the oblique.
Exactly. Area. So, and if you think about where people are most tight, it's their obliques. And that's why the breath goes from right where your hands are, where your obliques are, which is if you go inside your body about an inch or two, you hit the densest, biggest part of your lung is right there. But because we sit for so long and we brace for so long, this part of our body, our sides, our obliques get really, really tight. So you can't inhale and exhale, and the breath has no choice but to go up to your collarbones. And up there, you don't have a lot of lung. And up there, your vagus nerve is hearing that you want your blood pressure and your heart rate to go up. So we end up in this loop of dysfunction, and a lot of things go wrong from there.
Let's speak of things going wrong. Let's talk about your grading system. So you have a grading system, which is where you grade people from A through to F, and you graded everybody within the room at Jay's workshop. Akash came out at a B. I came out at an F. So talk us through how you. I mean, straight away, as soon as you looked at me, I could see kind of your eyes widen a little bit. Like what was I presenting? And then what led you to straight away? We alluded to this at the beginning of the call. Sorry, but the first 2 questions you asked me were, how's your digestion? How's your lower back? Which for those, it's been funny because a common theme amongst these podcasts recently has been me talking about my digestion. So that's why it really resonates.
Jason Ferrugia does the same thing. He talks about his egg allergies.
Yeah,
so it's a theme.
It is, yeah. There's something to it. So just talk us through the difference and what you're looking for with the grading system. Well, obviously, we're going to come to your book as well, which is you got it in black and white. But for those that don't have the grading system in front of them, what visual cues do they use?
Sure. Well, one of the things I do is I look at psychology, and is that usually when you go to a respiratory physiologist, they're going to do spirometry on you and tell you whether you have asthma, emphysema, or COPD. But the fact is that the breath is both conscious and unconscious, and it has to do very much with our personalities and our states of arousal. So when you look at someone breathing, you not only have to look at their mechanics and even the biochemistry of oxygen and CO2, but you have to look at their personalities in order to dismantle what bad breathing patterns they have. And you have to look at myths. So here's where the psychology comes in. If you tell someone you don't breathe well, you have to take more belly breaths and use your diaphragm, they'll nod, walk out the door, and not know what to do and never do it. So you really have to sort of go back, because breathing is so complex. It has a part of it that has to do with your personality, and part of it that has to do with mechanics, is that you have to look and see what are the myths that are keeping you breathing badly, and what about your personality keeps you breathing badly, and what about your sport keeps you breathing badly. So for bodybuilders, keeping your body narrow and tensing all the time is something that bodybuilders tend to do. With powerlifters, it's almost the opposite. Powerlifters, I can look at a bodybuilder and a powerlifter, know who does what by their posture and how they hold themselves. So powerlifters, because they brace by pushing out on the belt, will look different in their middles. Bodybuilders, try to get a bodybuilder to take a belly breath. Like, it's so tough. You have to bribe them and do all kinds of things, because they work really hard at staying narrow. For me, I looked to see how my breathing was bad. And I came from not only a cross-country and running background, but I was petite and I did gymnastics. So my posture, and I take this from Jill Miller, was of a short person, was of always trying to stretch up to be taller, and always being in this gymnastics position where I was ready to run across the mat and do some flips and things like that. So that posture for me put me in a scissors open, which is Leon Chaitow, who's fantastic if you want to read more breathing stuff. It put me in a scissors open, chest up, ribs flared, sucking in my gut. And I was also short, so I wanted to be taller, so I was stretching up forwards. But if I hadn't looked at the psychology of why that was my breathing posture, I probably wouldn't be able to dismantle being able to let myself relax in the middle, be able to understand the diaphragm, be able to get to where I was. So it's always important to look at what are the myths that are keeping your middle tense. So for a bodybuilding community, often squeezing the middle like you do when you brace, like you do when you pose. Yes, it's good to be able to have a good narrow pose for when you're competing in bodybuilding, but it's not a good posture to have the rest of the day when you're trying to get oxygen in your body, given that the part of your body that you're squeezing is exactly where the best part of your lungs are. So looking at someone's psychology and their story is really important. I had a flight attendant tell me, she looked back and she said, you know what, I have been bracing my middle for a long time because the airline I was with was very, put a lot of pressure on us to be thin, and our outfits were kind of snug. So she had been holding her breath and bracing that way. I have people that will say, you know, I got poked in the belly when I was little and got made fun of for being chubby, and I've been sucking in my gut ever since. You know, all kinds of myths and experiences that come around breathing. So looking at your sport and your psychology is very important. So back to the grade. The grade itself looks at range of motion and location of motion. So I'm looking at how much are you using your diaphragm? How much does your diaphragm expand your body and contract your body? Because the more that's happening, the better. And I'm also looking at, where are you breathing from? Are you using your shoulders? Are you using your chest? Are you using your diaphragm, the abdominothoracic breath? Where are you breathing from? So the grade is actually a combination of those two things, range of motion and location of motion. I'm sorry, that was such a long, explanation.
It's perfect, because I think people will resonate with it. So you're describing, you know, the psychology of it. And I'm thinking, well, you know what? I'm 5'6" and 3/4, and yep, the 3/4 does count. And I compete in bodybuilding. Right?
Yeah.
So I am quite short, but quite wide. I don't want to amplify being short and blocky. So plus, obviously, being on stage, you get marked down. You physically get marked down if you have a distended stomach. So it's just drilled into you to pull it in at all times. And then obviously, coming from a personal training background, walking around on a gym floor, you know, you want that big chest, big shoulders, small waist look. Yep. It's marketable. it's only having done your workshop that now I realize that, holy fuck, it really isn't. which leads me to another thing, actually. So we have the grading system. And one thing that you said is that one good breath equals basically 6 shit breaths, right? And what hit me was when I did start breathing correctly. So you had to sort of sit on our heels, breathe into the stomach, use the diaphragm, pull in the abdominals on the exhale. And I felt really lightheaded after a few minutes of it. And I turned to Akash at one point and was like, I feel like, a little bit, almost like tipsy. And I'm guessing, and maybe you can correct me if I'm wrong, but it's just because I'm getting so much more oxygen into me compared to what I would usually get in the time frame.
Well, it's not necessarily more oxygen, because the whole idea of flooding your body with oxygen isn't really very correct. Mm-hmm. It's really that you're used to walking around taking tiny little sips, and all of a sudden you're taking a much bigger breath. So you're getting much more CO2 out, much more oxygen in. There's a change in your nitric oxide. All of a sudden your middle can relax. So it's a combination of all these different things. Plus, your diaphragm is actually moving where it's been constricted. So if you think about the diaphragm as this muscle that really, it extends throughout the entire middle of your body. And part of our not understanding the diaphragm is why we're not using it. But if you think of the size of a pizza or a Frisbee, this is this enormous muscle that's in the middle of your body that you've been squeezing with your obliques. So all of a sudden you're relaxing it, and your whole body is responding and making you a little high and a little giddy, and kind of a nice high.
Yeah, I felt like it was like a mini little high feeling. It was odd. But it was kind of like, oh, wow.
Kind of nice. Yeah. So that's what was happening with you, is that all of a sudden you're allowed to breathe the way you're supposed to be breathing, the way you were designed to be breathing. And it feels strangely good, to the point where people will giggle sometimes. And it's that bracing that, we've been bracing for so long, especially nowadays, is that if you are upset, whether it's at work, or whether you're going on stage and you're just trying to keep things together, is that you brace. And if you think about it right now, is that if you were to, gosh, you look so comfortable, I'm going to get you to brace for a second, is like, just sit up for a second and go, okay, I'm going into that meeting. And it makes you feel good of like, okay, brace and let's go. So it's a stance. So just watch yourself go, okay, I got this. So all you have to do is tell yourself, I got this, let's go. And you will brace your middle. It's just a human reaction to let's go. Now here's the problem. If you're always bracing to go to the next thing and the next thing, you never let go of your middle. And now you're thinking, hey, I'm actually working out these muscles. This is an isometric to keep me narrow. And it's the perfect storm for, you're cursing, so I know I can curse, but this like shit storm to be happening inside of your body, that things start falling apart. And because they're so far from the origin, you don't recognize that it's you not using your diaphragm or breathing well.
Is that where it links to the psychology side of things you were talking about? Because your body's locked in that sympathetic, ready to go, fight or flight mode all the time.
All the time. And all the time, it's interesting because a lot of people ask about stress. It's not well explained why we're so stressed out. In general, when I have people say, oh, we're just softer than other generations, that's why we're so stressed out. And I agree that a lot of us are suffocating in our own first world problems. We need to have better perspective on them. However, the physiological component is that we're always in this braced ready stance, whether it be ready to answer a snarky Instagram or ready to go into a meeting or a competition, but your body's just braced and ready to go all the time. And that's the sort of stress that we're experiencing that's different from other generations, is that we don't have, I'm not saying get rid of the stress necessarily. I'm just saying take a break from the stress every once in a while to take a deep breath. And then if you want to go back into it, that's your choice, but at least give your body, a few seconds of taking a deep breath, going into parasympathetic before you go back into sympathetic. And that's what's actually going to help you go to sleep at night. And one of the reasons people are not sleeping, I mean, there's a host of reasons that have to do with GABA and magnesium and bad sleep hygiene and all kinds of other things. But if you throughout the day are stressed, then take a breath, put yourself in parasympathetic, go back to stress, and you actually have changes in the amount of stress throughout the day. When you go to turn off the light at night and go to sleep, you'll be able to. Because otherwise you're just in, code red alert all day long and then trying to get into bed and going to sleep, and it's not working.
Yeah. Something I've been doing now before bed is practicing this breathing, because, it's going to take a while for it to take effect. Like, breathing is something that you just do without thinking. So since one of the things you said at your workshop is that you'll leave this, you will be breathing better because I think you called it your breathing IQ. Is that the right term?
Yeah, your breathing IQ. Just learning what you did, your breath will never be as bad as it was before.
That's it, yeah. And I would agree with that. But naturally, because it is still the early days, or throughout the day, if I do get stressed, I probably am subconsciously going to be breathing through my shoulders. So I make sure that now when I get into bed, I'm consciously breathing through, and I'm doing it. And I do feel more relaxed. But it also leads me on to something else, which I brought up with you in the workshop. And I'll mention it here, which was I felt a difference in my digestion. So you hear stories of older women doing yoga and farting.
Pelvic floor.
Yeah.
You know what? I've had people fart around me of all different ages and situations. It's just yoga does that to you.
Yeah. I hear that in yoga, but doing this breathing stuff, I'm feeling like everything, it feels like bubbling in my digestion, like things are moving.
Yes.
For the first time. Talk us through that. Like what's happening there? Because I'm still getting it. If I do a couple of days where I don't practice the exercises, then I get into bed and I do it. The first thing I feel, it feels like, maybe this is completely wrong, but it feels like peristalsis is actually working for once. Like my digestion is super slow. And it sounds maybe a little bit hippie, but it feels like things are moving and like blood flow it's really bizarre. It's an odd feeling. People that are listening to this, if you're breathing like me and you're trying this, I think you'll notice it straight away. Like, Akash, you didn't get this effect, did you?
No. Because
you came in at a B. Whereas if you've got other people, I guess, that are coming in around the sort of level as I am, what's going on there?
Exactly. Well, you answered your own question perfectly, which is that two parts is that depending on the grade you come in, you're probably, if you're at an F or a D, there's going to be more medical problems that you have because breathing is the foundation of your health. Mm-hmm. And if you're coming in closer to a B or an A, which seldom happens, you're probably going to have less stress, less anxiety, and less medical problems. It's just, it goes together. That's why the grading system works. And as you get better and your grade gets better, you'll see that whatever symptoms you came in with also alleviate. Mm. So you were spot on when you said peristalsis. And peristalsis is that sort of wave-like massaging that happens in your belly. Your intestines do it, but the muscle that actually supports peristalsis, that helps it out, which is incredibly important in digestion, is the diaphragm. So if you can imagine the diaphragm from above, think about, again, a frisbee, and it's massaging the intestines below it. Now, if you're not using your diaphragm, then your intestines aren't getting the massage below it, which means that you're going to suffer from irritable bowel, you're going to suffer from constipation, you're going to suffer from acid reflux, all the things that have to do with your gut, because you're not getting the massage from this enormous muscle right above it, whose job is to massage your intestines to get you to be feeling better. So it's spot on. Yeah,
it's a really bizarre feeling, but like a really good one.
Yeah.
You're laying there like thinking, okay, this is probably like what should be happening.
Yes.
This is what is happening in other people 24 hours of the day. Because I'm only consciously thinking about this for this, 20 minutes before bed. I'm only getting this 20 minutes of the day. So I need to work on, increasing that, which now leads us on to your book. So I've got it in front of me, Breathe, which is basically on improving physical and mental health, right? Within 14 days. Talk us through sort of the premise of the book, who would benefit from it, where can people get hold of it?
So in the UK, it's published by Hay House. So it's right there. And in the US by St. Martin's Press. And, we pretty much went over the most important parts of the book, so you don't have to get it, even though if you want to, that's great for me.
Well, I would recommend it not only for you, but just because it's got all the, visually, it's got all the diagrams in it. It's got tables so you can grade yourself. It's got a tracker at the end of it. And you can take your time actually reading and, digesting it all.
Back to digestion.
Back to digestion.
Yeah, thank you. So the book is super simple. It's for pretty much everyone that breathes, that either is feeling like they'd like to figure out how to breathe for their back health, the symptoms that I see most people come in with are low energy, trouble sleeping, digestion problems, problems with their back, cravings. So it's everything that has to do with your psychology if you're wanting to calm down from anxiety, or if you're trying to deal with pain, because how you breathe is linked very directly to how you experience pain. So there are all sorts of symptoms which you can keep track of. And it's not specific to sports, because you have to actually get to an A before you can get into sort of the more endurance part of breathing. And what I'm working on now is really focusing more on how you breathe for different sports and how you breathe for sports that have to do with endurance, and sports that need you to be able to brace well under load, and precision and recovery as well. So I've had teenagers read the book, all the way up to, your mom who's saying that she's, feeling breathless. She's feeling like she can't catch her breath. So it's really, I love this book because it really stands for everyone. And even if you are an athlete and a good athlete, get your BIC, your breathing IQ, to be an A, and then do the exercises as hard as you can. And it's way harder than you would think, just breathing, because you're working out muscles. It's really about the mechanics and the muscles in your body.
Well, we did the forced exhalation drill, and you put on some pretty aggressive music, and it was hard work. It was really hard.
What did we listen to?
It was Rage Against the Machine and Public Enemy.
Oh yeah, and Public Enemy. Yeah.
And then all of a sudden went into meditation music. It was like a complete contrast.
So, trance breathing is not something new. It's been around at least since the 60s, of inhaling and exhaling in a way that you control, but you're doing it hard. So it's called controlled hyperventilation, and different people have different names for it, but it's been around for a long time. I certainly haven't, it wasn't anything I particularly discovered, although I use it in my class because people are interested in it. It's different variations of controlled hyperventilation and trance breathing are holotropic or transformational. Everybody has sort of their own name and their own twist on it. But what it is that you take big inhales and you take big exhales and you do it hard. And then both because of the endorphins, because of the change of the chemistry in your body, because of your breathing in a way that supports your parasympathetic state, is that you are able to then sort of get into a meditative state afterwards, where you sort of feel like you're floating, and that's where the calmer music came in. So that's what the meditation was at the end. I call it meditation for people that can't meditate, and for people that aren't interested in meditating, who just want a breathing muscle workout, you can do that as well, because there were people in the class who were doing that 2-part breath, which is belly breath until you can't take any more air, then add a little bit by pressing your shoulders back, and then exhaling hard using your abs and your obliques and even your intercostals. And you do that over, it could be 30 seconds, it could be a few minutes. But if you're not interested in the meditation, but you're interested in a workout, it definitely is a workout. So it satisfies 2 different types of people in an audience.
Yeah, it was good. And the meditation bit was nice because I've never really done it properly. So it was kind of the perfect blend of both. Is there anything else breathing related that you think that our listeners would benefit from that we haven't covered?
I think back pain is important to talk about. And a lot of people don't understand why breathing and back pain are brought up together. And it's again, purely anatomy. It's not Dr. Belisa or magic or anything like that. Is if you start understanding the diaphragm and you realize where it connects on your back, you'll realize that a lot of your back pain has to do with diaphragm dysfunction, not necessarily that there's anything wrong with your spine. So this idea and my studying this started with John Sarno, and I'm a big Stu McGill fan, where if you start understanding that sort of your diaphragm is roundish and the tail of it, if you think of it having a tail, attaches to your spine. And then up from your pelvic floor attaches to the back of your spine. So if you have pelvic floor and diaphragm dysfunction, if you're not using your diaphragm, you're not moving your pelvic floor, and they're connected by the psoas, your back's going to hurt. You're going to have herniation. You're going to have problems, around the L4, L5 area. And as you're going to different professionals, because it's obviously, there's not always a simple answer for back pain or back problems, is that you have to look at your diaphragm, you have to look at your BIC score, and you also have to make sure that your pelvic floor is in good shape so that you don't fart during yoga and you don't leak when you're running or jumping, because that's not natural, that's not healthy, and it's a very slippery slope from that to pelvic floor herniations and adult diapers and things like that. So that should not be happening. If you're leaking, if you're passing gas during yoga, that just means your pelvic floor is not strong or it's too rigid. Regardless, it's dysfunctional, and you need to go to specifically a pelvic floor physical therapist and make sure that your diaphragm is working well, because those two things are very much connected to your spine and are really a central focus of back health.
Perfect. Nailed it. Akash, anything that you want to add at the moment?
One question I had was, say you're doing a bicep curl, for example. How should our clients breathe?
Oh, great question. Oh, that's a whole nother workshop, and I'll try to keep it short. But what you're wanting to do when you lift is that, are you doing lightweight or are you doing heavyweight? So that's what you should be looking at.
Yeah, let's say
and most people.
Yeah, okay. Sorry.
So if you're doing a lot of repetitions, is that you're going to want to exhale as you do the rep, or exhale at the end of the rep. Yeah. So with the bicep curl, because you don't need to have too much stability in your core, although it's good that you have some all the time, is that you exhale on the curl and then you might inhale on the more passive movement.
Yeah.
But that's only with light weights. Usually if you're trying to use heavier weights, you're going to inhale, brace your body, and then you're going to exhale on the sticking point and then exhale at the very top, re-inhale, re-brace, and move again. Yeah. So the two biggest problems I see with breathing at the gym are either holding your breath the entire time you're there, or going in the wrong direction. So breathing and movement is really fascinating in that your breathing supports the movement that you're making, and it makes for you being able to do more reps and heavier weight if you're doing it right.
Yeah. I always find if I get the right breath in on a say a hack squat or a Romanian deadlift,
yeah,
I'm always more stable, I'm stronger. It makes a big difference on the overall lift and the way it feels. Like even for example on a hack squat, if I get my breath right, if I don't get it right, my knees might not feel as good. Whereas if I breathe properly, I'm more stable and I can engage the glutes and all of that.
I'm listening to this thinking,
laughing, but
no, I'm laughing because I know I'm going to get an influx of questions from clients now. And I know exactly one client, and you know who it's going to be. It's going to be the first person asking it too.
Well, I love that you bring up, Akash, I love that you bring up a hack squat, because of the position, you can't breathe vertically. So I like taking people into the gym and making them do movements where they can't take a vertical breath.
Yeah.
So if you take, you're because of the weight, you can't. So what's great about the hack squat is that you have to take a little bit of a belly breath, or you have to take a lateral breath. So you have to be able to do that to get the pressure you need to be able to get that next rep. And you'll know you're not doing it right when you have that sensation of, that didn't feel quite right. And I want people to tap into that intuition, because it's when you don't listen to that, when you get injured. So what's nice about the breath is that you will be more in tune with your body when you're at that moment that you say, should I do another rep or not? Do I feel safe? Do I feel like this is a position of high stability where I can continue, or should I re-rack or take a breath? So being able to breathe and breathe right gives you intuition about that so that you don't get hurt. And then there's
go on.
Go ahead. No, go ahead.
I was going to say, especially on low back intensive moves like a bent over row or a deadlift or a Romanian deadlift or anyway.
I love deadlifts. If I could go in and do legs every single day, I would, because I love doing legs. It's hard to get me to do anything else, begrudgingly I go in and do back and such. But when you're doing squats, or when you're doing a movement where you need to brace, then the conversation gets really interesting, because how do you brace and breathe? Do you need to brace and breathe? How do you do a good Valsalva? How do you engage your pelvic floor? Because you should be. So that conversation gets really, really interesting. But most of the time is you want to, if you're doing a lot of weight, is that you want to inhale, brace well, exhale on the sticking point, just a small, and then take a breath at the top and do it again. But you have too many people who are either exhaling all the way up, so you're losing stability as you come up when you really need it, or holding your breath so that you fatigue. And this from exercise literature, is that fatigue, if you're tired, you are not going to be able to do as many reps, obviously, and you put yourself in a place where you're not safe. And oxygen is cell fuel, so being able to take that breath between sets is really important.
Yes.
Awesome. Perfect.
Makes a lot of sense.
Yeah, I like that. Thank you very much. So for the listeners listening to this, we've mentioned the book, but where else can they find out about you?
So thebreathingclass.com is the website, super easy. Dr. Belisa on Instagram, and Facebook, The Breathing Class. That's pretty much it. Yeah. And probably some airport somewhere. That's where I'll be.
Perfect. Let me just go to our rapid fire questions. As we always finish the podcast on 3 rapid fire questions. So the first one is, you mentioned at the beginning of the podcast that you're a sex columnist for Men's Health magazine?
Men's Fitness. It was Fitness. Health and Sex. Yeah.
So let's skip the health. We've covered that. Let's go straight to the sex. Give us one tip that guys can instantly implement to improve their sex life.
Instantly implement. Knowledge of female anatomy. So not using porn as a teaching tool. So how graphic can I get?
Go for it. This is no. Don't hold back. Go for it.
Yeah, I think working on your oral skills is really important, because most women will not orgasm with intercourse alone. So making sure you know where the clitoris is and paying lots of attention to it, I think that's pretty much your sound bite that will get you called over and over again.
Perfect. Awesome. Next one, your favorite city to teach in, or even favorite city you've taught in as a one-off.
It's not about the city, because I'm not, it's more about how enthusiastic and kind of wild the group is. Mm-hmm. So I can't do a fast one on that, because I'll go to a city and I'll never make it to their museum or their best restaurant. So it's more about, can I get a group of people who want to do a lot of work, who are asking a lot of questions, who don't want to leave. So I'd probably say my favorite group to date was your group, because it was
really great. Last question. Yeah. Last question. Who should we have on our podcast next?
Ooh.
This is actually, I'm going to ask you a follow-up question to that as well. So let's go with that one first.
Sure. You know what? Laura Zera, I think is really fascinating.
Sorry, how are we spelling the surname?
Zerra. She's an extreme survivalist.
Oh, okay.
Who I really love. Jill Miller is someone I adore, who's super smart and just knows the body and the diaphragm really well. I think that I love other people in the breathing community. Brian McKenzie and Power Speed Endurance do something very different from what I do, but it's super interesting as well. I can go on. I have all kinds of people in all kinds of places.
No, these ones that you just listed are perfect. They just give us somebody to reach out to. That's amazing.
Yeah.
Part two, then the second question to put you on the spot. Would you feel comfortable coming back on here and doing an episode on sex? Because it's something we haven't done. We've done training,
talk about anything, yeah.
Mindset.
Yeah.
I think that would be quite an interesting one, right? We have a lot of our listeners are guys, and even it's going to be applicable to girls too.
Sure. I'll talk about anything. I know that I'll have people do the breathing and talk about pelvic floor, because if I can combine talking about sex with pelvic floor and with breathing, it definitely makes for better sex. So I would definitely come on, and or give you someone who is more up to date with maybe the more cutting edge, sort of louder, more feisty, fetishy driven stuff as well.
See Akash grinning away there. Perfect. Yeah, that would be awesome if we could talk about it afterwards.
Yeah, you wouldn't believe how many people do the 2-part breath or start using the pelvic floor in combination with the diaphragm.
He's leaning in now. He's leaning close to the screen.
He's leaning in, right? I'm feeling like, I'm feeling a little aroused now. Is this normal? I'm like I'm hungry and I'm aroused and I feel more awake. And so I get that question.
So using the 2-part breath during sex, you're saying?
No. Well, think about it, is that when you exhale, you're contracting your pelvic floor. When you're inhaling, you're relaxing it. So you're actually ending up doing pelvic floor contractions and strengthening your pelvic floor, which is kind of what you want, to be able to have sex longer, have a better pelvic floor, have stronger pelvic floor muscles. So both for men and for women is most of us don't do Kegels because they haven't been explained well, and because we're busy doing other things. But if you actually combine it with your breath, and we can do this right now, and I'll leave you with this, is that if you inhale, so tip forward, I need to see both of you inhale and relax, and I want you to feel your pelvic floor, and your pelvic floor is your bicycle seat. So pretty much think about that part of your body that hits your bicycle seat, that's your pelvic floor. So as you lean forward, the gooch. Yeah.
For the listeners,
I want you to feel your pelvic floor. So inhale and feel it press against your chair. And when you roll your hips back, exhale, squeeze your lower abs and contract your pelvic floor like you're trying to not pass gas or you're trying to hold back urine. So there you have a pelvic floor contraction, but make sure you relax that as well. You don't want to stay in that braced position all the time. Inhale, rock forward, feel your pelvic floor, all that space between your sit bones, your bicycle seat, press against your chair, gently. And now on the exhale.
Yeah, Akash is getting a bit into this. If only the listeners could see this.
He is. He's grinning.
He suddenly is. Exactly. See these big teeth everywhere. Suddenly put blood in his cheeks.
There we go. So there you have you're helping out blood flow in your pelvic floor and everything attached to it. You're helping those muscles contract and expand as well. So you're taking care of your pelvic floor, which means that you're not going to have a pelvic floor herniation. You're going to have better blood flow. So it's obviously going to be better for sex for both men and women. So there you have a tip and the starting of the next podcast.
There we go. Perfect. Amazing. Thank you so much.
Thank you guys for having me. This was so much fun.
Thank you. Akash, do you want to do the outro quickly?
Yeah, so if everyone's enjoyed today's episode...
He's caught off guard, he is. He's flustered.
Everyone's enjoyed today's episode with Dr. Belisa. Please share with your family and friends, hit subscribe, and leave a positive review. For more information on Dr. Belisa, please visit the show notes. And to get more information on us, please visit RNT_Fitness on Instagram, or at Adam Haley with #1, or at Akash Fagela. And for more education, please visit www.rntfitness.co.uk.
Perfect. Amazing. Thank you very much.
You guys are great. Thank you so much. Invite me over at some point. I'd love to come over.